Welcome, Rocklend, to the Creating Disruption Pod. Welcome, Rocklend, to the Creating Disruption Podcast. For those listening, Kara DePaul is not able to join us today. She's out on assignment. So it's just me and you. So thank you again for agreeing to be a part of it. And I also want to say congratulations for winning the Adjunct Bessie Award recently.
Thank you.
But you are also now full-time.
Yeah.
Full-time. So welcome to the college.
Yes.
As a tenure track.
I'm happy to be here. Yes. I really wanted to begin just by saying I wanted to thank my students as nominators and also the other nominators from my faculty, mentor, and also Tri-C for allowing me the opportunity to work with such an amazing, diverse student population. Because without them, without you, even to be considered in the as a Bessie Award winner, and without the support and help from everyone else, I wouldn't be here in this position, let alone just be teaching. So I really wanted to take the time to thank everyone from the bottom of my heart, how important, how special that was for me to really come full circle. And but it's also commitment that I want to make sure that I continue to reach students, to be a support for other faculty, other coworkers in not only just in health professions, but throughout the college. So I want to lend any type of support that I can in this, because again, we're all in this together. So
no, absolutely. I would say one of the things I love about teaching here is just how supportive the environment is.
Yes.
All around, from your coworkers, your colleagues, to the different areas and the different departments.
Agreed.
And it's really just a wonderful place to work, and to be able to go into the classroom and know that people have your back,
Yes.
right? And that you can do the best that you can to help your students be successful in the course and at the college in general.
Yes. When I usually drive to my PRN job, so I work also. I work a couple days a month as a PRN physical therapist assistant, and that's what I do. Also, by the way, that's my other trade, is that I also work with patients as a physical therapist assistant at Summa Health. So I live in Shaker Heights, so I drive about 50 minutes to Barberton or to Wadsworth. Not only am I committed to students, but I'm also committed to patients and also offering great care so that the students can. And I can essentially lead by example, but one of the things that I often mention and talk about Tri-C is that I get a constant reminder that when I do drive down to Summa and I'm driving back, I see this big, huge billboard about Tri-C, and on it says where futures begin. And not only is this where a future began for me in teaching, but it's also where future began for students. And I honestly believe that Tri-C is this institution to where you get the opportunity and the ideas that I shared with my mentors and program director, Tanya Wright, and also our preceptor. They're always willing to support the idea and even giving some additional instruction there too as well. So totally agree with that. And it's very motivating for me because it empowers me, and the students feel that empowerment, so they're empowered there too as well. So I think it's important to students see that, because when they leave here, they leave this institution, they're going to make an immediate impact, no matter where they go in the community, professionally, and also through in their life. So that's my hope, to instill that power where and understanding where you came from. So.
And it must be a tremendous asset to your students to know that you are still practicing consumer health, and being able to continue to bring that experience into the classroom. I mean, that has to be something that's very beneficial for the students.
Correct. So correct. And one of the things I know that we'll be talking about soon is how I'm creating a disruption in the classroom. But one of the things when I've gone through clinical development, not only as a clinician, but also as an educator, as a clinical instructor, is giving students the ability to clinically problem solve, to see, essentially how well they are able to think on their feet, how can they prepare for a situation for that. And one of the things is that I feel that as a clinician, I have to model that that clinical experience, model clinical excellence in the classroom there too as well. Everything from showing up on time to how we educate each other. So students have to educate each other. So we come from different backgrounds, different cultures. So it really helps to, really this whole practical experience and bring that in the clinic. And again, modeling that experience so that when our students, again, get out to their clinical rotations and when they go out and they graduate, again, that's how they make that immediate impact. So yes, utilizing my experience as a clinician and bringing that in the classroom, to help students better prepare. And you also get a feel for what this profession is going to be like, what to look for, what are some of the clinical pearls, and what are some of the pitfalls, how to deal with burnout, because healthcare is an awesome field, and it is tough because there are constant changes. How to better align yourself and to budget your time accordingly so that not only you can treat patients effectively, but also to have a life at home with some of your loved ones and to also enjoy yourself. So I think that's a big thing where I really want to continue to practice for as long as I can. You can actually kind of say that I'm trying to train the next generation to essentially take my spot clinically, even though, again, I'm not, replaceable, but I do believe that my students, when they go out here, they can make an immediate impact no matter where they go, and eventually replace me so I can, keep doing what I need to be doing here at Tri-C, right? So,
Right.
Right.
But also, it's also teaching a little bit about balance in life, right?
Yes.
Life and work, and
Yes.
that's important.
Yeah.
Especially with, as you were saying, preventing burnout.
Yes.
Right.
Yeah. So when it's actually pretty funny. So I don't know if it's pretty funny, but it was a time where as I was transitioning to my full-time role, I was completing my dissertation. I think the hard part was taking the comp exam. So the comp exam. So that was the hardest part. And you can, I don't want to say you kind of coast, but as long as you're staying up to date on your deadlines, which I did struggle sometimes, and because I have I work full time. I'm here at the school, and then I also have a family. I have 2 kids, and but one of the things I do remember about that, and talking to my chair, and when there was things going on with my daughter in the summer, they made a point to reach out to me, not in the email, but they made a point to reach out to me, recognizing that you're human, you can only do so much. But they were completely understanding about my situation and that balance. So that really said something to me, and really again instilled upon me that I have instructors, in my PhD program and my chair who understood that I'm a student first. I'm a human first. That it didn't matter what credentials I had, my position here at Tri-C. They took the time to make sure that I understood that, they got to take care of yourself. So, I that helps. And I essentially am an extension of that because that was really, again, empowering for me, to do that. And, again, recognizing that students are humans, as an instructor, we're humans too as well. So, it's very important for a student to see that balance and to understand, to know that we're here to support them and understand that they're human beings first, because when they get out there, they have to, again, take care of themselves. That will definitely could help with burnout for sure. But it's like one of probably the fortunate things about going into the program, because you think that it's all about deadlines, and it is, but they made a specific point to me. I even saved some of the emails, so to make sure that the follow-ups, and they knew exactly. They started everything with hey, how's your kid? How's school? How's everything going to Tri-C? So, but I always smile when they talk about my kids, and they also talk about my students, because they know that I'm passionate about both my family and my students as well, and also how I can be a contributor here at Tri-C.
And that's so important in terms of thinking about how empathy plays, right? And recognizing that when it's when people are being empathetic to you, and realizing that in these positions as teachers, it is okay to see students as humans, and being to recognize that they're going through things, right? And part of our job is to make sure they know the content, but part of our job is just to pretty much say, hey, I see you.
Yeah.
I recognize what you're going through, and I can do what I can to help you, or at least put you in the direction where you get the help that you need. And it's great that you have that example.
Yeah.
Because sometimes, I know, I feel like I was in college a long time ago. But at that point, it was more, you do the work and that's it, right?
Yes.
I don't want any excuses whatsoever. A due date is a deadline. There's nothing beyond that. And, sadly, I would say for me, when I started teaching 20 years ago, that was the model that I had.
Yes.
And then I realized that it's just unfair because I'm setting students up for a world that it's not that rigid.
Yeah.
Right.
Correct. Yeah.
And
it's a good point because I think about that all the time. In terms of all this everything just everything is this. You think about when the students leave here, and I can relate because as a clinician when I'm in the field, I know I'm preparing them for this education, but there's other things in the work-life balance where you kind of wonder, like, I wonder how they're doing out in the field, how they're managing, and I think that's part of the other part of it is just kind of trusting your education, trusting how you're teaching them, how you're preparing them, and that goes with them, and it does, but you constantly definitely worry about that. I mean it's something that I think about, not necessarily when they go to clinicals, but again when they're kind of fully fledged as an entry level clinician, and then dealing with the work life balance, and there's no homework assignments, but there's daily tasks that they have to do, such as completing documentation, completing notes, schedules change, there's productivity standards, so there's stuff that again you want to make sure that you prepare them for. And I really want to speak real quick in terms of students, and again empathizing with students. I was at a leadership development conference through the Ohio Physical Therapy Association, I believe it was last year, where we got to talk to PTA students from across the state, and they invited two students from each program to this leadership development conference, and myself and another faculty member from Cleveland State University spoke at this conference to talk to PTA students and talk about how to develop this relationship. But the key takeaway from this experience was not only that, but the presentation. One of the speakers was Dr. John DeWitt. He is a professor at the Ohio State University in the DPT program, and he talked about mentors and who mentored him. And of course, there's a big one. He's really well known not only in the state of Ohio but across the country in terms of physical therapy. So he had this big wheel of people, including his family, one of his previous mentors, and someone at the Ohio State. So it was a really big wheel. And then he got to the last one. And there was a group of looked like younger kids, students, and he asked us the questions. Who would have thought? Do you guys think that students could be mentors? So everyone was kind of looking around to each other, and it was at that moment where it really clicked for me, the whole purpose and empathizing with students. Like, okay, this is it, right? Because and that really kind of set the trajectory for me to really kind of having to to essentially this name of the podcast, creating disruption, to find ways to meet students where they are, and you do that by empathizing with them, and then also being honest with them about, hey, this balance, this road that we're taking, and you kind of being over budget on studying for these assignments, we got to talk this through, and then they tell me about their problems, and again, that's a point of mentorship for me, where I get to know more about the student, because we can't just assume, right? So, but the students will talk to me and share some of their things, that, hey, this is what I have going on right now, right? So, and I think that's important, especially again, someone who's high profile as Dr. John DeWitt, it really hit me that that I can be mentored by students for sure, that I'm here because of them, right? So
As you were talking, I was thinking I was at a conference recently, and the speaker was talking about poverty, generational poverty, specifically. One thing that she kept stressing is we need to seek to know the why.
Yes.
Not just automatically jump to a judgment.
Yeah.
Because when you figure out what the why is, you realize what can be helped, right? If it is they're always late, why is that?
Yes.
It could be bus schedule, it could be, the ride isn't coming as consistently as they thought it would. And that helps with this idea of empathizing with what's going on instead of just saying, no, you're not here.
I totally agree with that. And I think that's the thing, where that whole empathy comes into play. And I teach empathy, I teach empathy in my geriatrics course. So it is they're in their third semester in the program. So they're starting this fall semester as second years. And we get into the death and dying part of the lecture, because in geriatrics, as a clinician, there are things that I can't prepare a student for in terms of dealing with death and dying. And even though we try to teach students to try to, form a professional barrier, but it's so hard if you're so good at working with people and you're genuine that, it's hard to, you develop rapport and a relationship with the patient, right? So we talk about this whole empathy and again, understanding, what's going on in the patient's shoes, right? And it goes beyond just being death and dying. I mean, we can talk a little bit just about you're working with a patient one day and then all of a sudden the patient just comes at you and they're upset, right? And they don't want to do their treatment. They're treating you rude, right? They're dismissing you. And they've never done it before, so one of the things is okay, well, fine. All right. So then I'll just leave you alone. But as clinicians, especially at PTAs, we work with these patients the longest. So, and again, I explain this to the students that as a PTA, we're working with this patient the longest. A PT is going to come in, they're going to do an evaluation. PTs are definitely involved in their plan of care. So it's not like the PTs evaluate and leave them. A PTA, they're going to be working with them more as treat them as follow-up. So you're going to know what's going to happen, right? You know what's happening between each session, and all of a sudden, boom, they're upset. They don't want to do anything. They're just so dismissive about everything. They have a bad attitude, So then, as part of the lecture, I explain to them, this patient got a terminal diagnosis, right? This patient is 88 years old and now they got this terminal diagnosis, right? And you didn't ask the why, right? So it begins with why, and that's one of the things we teach in the program is they get to ask those why questions, right? Students early on, they roll their eyes, right? So why are they mad? Well, but again, now geriatric hits them. This is why someone's being upset. So I can definitely see that these instances in terms of what we deal with as faculty and dealing with life and students' life, it's actually applicable into the real world, because that happens. And I talk about students and being tardy and late for work, or a patient being late as well. And again, understanding having the confidence saying, hey, I've noticed that you've been, showing up late. Is there anything that we can do to help you? Maybe we can schedule this appointment a little bit later in the day. So those are things, and I love that moment because, as students now, we're typing on notes now as opposed to we're just writing down. They're stopping to type and they look up, and you see a few heads kind of look up, and when they see that, you kind of know that you've reached them, to where I'm like, okay, good, this made this point, right? So so it is, again, a very somber lecture. I mean, no one really wants to talk about that. It's not my favorite lecture, but that whole empathy part, and again, modeling that clinical excellence in teaching, just asking that why, again, that's really what it is, and that's what makes a clinician, and that's what makes an instructor an instructor. We gotta be attuned to other things because we're here to help them, and we can't help them if we don't ask why. So it's really kind of the same.
Yeah. So in terms of helping students, what ways have you disrupted your class in order to help them? It's either could be a new assignment or a project using technology, different approach. Why did you make the change and how did it go?
I'm glad that you mentioned that. So this is how I disrupt the classroom. So I use a software. It's called ClassPoint, and it works like Kahoot and Aha Slides. But I liked ClassPoint because it's for PowerPoint, so I didn't have to upload my slides onto a web-based platform. It was all done on ClassPoint, on PowerPoint. So it works just like Aha Slides and Kahoot, where you give the students a code, and there's even a QR code, so now they can use the phones. Again, I'm not necessarily, phones. I mean, students are on phones, so not that I saw students be on the phones a lot. However, I wasn't sure. So, and I really wanted to engage the students, find ways to engage the students, give them material so that I know that they're getting invested in the material, show some interest, engage, spark curiosity. So ClassPoint is an active response system that allows you to engage students through multiple ways. It has word cloud, it has multiple choice, multiple answers, it has short answers, even have the slide drawing. I'll talk about the slide drawing here in a moment. So, but for word cloud, I have a geriatrics in my geriatrics course. I have a video, and it's the video is titled "Know Your Purpose." So it's a video of an older gentleman, and he gets up one day. It's snowing. You don't really know the background, and all of a sudden he picks up a kettlebell and starts working out. So as the video goes on, he's lifting this kettlebell, which is about 40 pounds, roughly 40 pounds. It looked heavy to me. And he's doing a motion where he's trying to pick the kettlebell up and lift it over his head. So at the end of the video, it's kind of like that whole Hallmark moment. His granddaughter comes running down the stairs, and he picks her up and gives her the tree topper to put on top of the Christmas tree. And after the students are done shedding some tears, I then engage them on terms of like, so what does this mean to you? Like, what would they talk about the moment? So we can do it as a word cloud. We can do it as a short answer. So again, I can engage them right then and there. The slide drawing I like because I teach a little bit of electrical physiology. So I don't have a major in electrical physiology. However, I was well trained when I went to school in it. And it was part of my PTA education, is part of PTA education here. I've done continuing ed courses. But it's hard to understand what the waves are doing. What are these little waves, these little, what we call sinusoidal wave patterns, right? Let alone my first time seeing some of those wave patterns outside of, not being exercise physiology. I've never seen them before. So we have to teach that to students. They have to understand the different polarities and all that type of stuff. So as they're learning material, I go back and I engage them again. Okay, now draw me a biphasic waveform. Draw me a unilateral biphasic waveform. So they can draw that, so I can actively engage them, and I can see if a student is getting material or they're not getting material. Again, not to call them out, but again, if a student were to struggle, I can come up to the student like, hey, I noticed that, for one, you weren't participating in this ClassPoint. I find it very hard unless a student is not there. I find the students always going to log on to ClassPoint to be engaged, because if they are on the phone, if they are doing something else, the ClassPoint is going to bring them back to, and they bring them back to, so that they know, that I should start paying attention to this because he's asking these questions more often, and I wonder where this is going to go. And that's another way I can model clinical excellence, because now if they're approached with a case scenario or a case study, I can go over what I would do. In this case here, this is what I would do. And I can, again, engage them first. I engage them first, see what they would do, and then I would go in, so here's what I would do. And then the students kind of match up to see if that's how they did. And then the other way there too, I can go ahead and have them write on something else, and then I go through my steps in terms of what I would do if a patient's non-weight bearing, what side I would have them transfer to, so they see how I'm thinking, and then they can see if that matches up. So I do both. I have them start it, and then I'll start it for them, so they can kind of see both. So that's a way for me to really be an extension there. Now, it's not the only thing that I do, but I find that ClassPoint really was something that I love, and I like doing it. The students love it because again, it's on PowerPoint, so they can go back to it and they can kind of essentially have a concept map in terms of, okay, so what was this question about? Why did you have me draw these little weird lines here, right? So again, that's one of the things where I really felt that to really help engage students and also think clinically, I needed to do it in real time as they're doing it, because they can get that in the lab, and they're always going to get that in the lab. But I really wanted to make this connection and getting them close to the material as close as possible, so that way they can see essentially what I'm thinking. I can see what they're thinking. I can see their response. You can time the responses so they can kind of get a little practice themselves on, on answering a question quickly if that's what they so choose. But and it's going really well with that. I was able to write a grant for it, and we're got approved, and I'm looking forward to not only getting training in that, but to also share the data and the responses and the classroom engagement from the students, and and share that with the other faculty in the health science program, physical therapist assistant program, to share this is how we can engage them better, and again the students it's intentional to where they're going to respond. You're going to get a response from them, and you're going to know, do they understand the concept? Well, did they pay attention to the concept, right? Because there's so many layers to learning, but at that point right there, it's happening in real time.
I know one of the things I talked to your onboarding cohort about active learning.
Yes,
and
I was going to talk about that.
The whole idea of like showing what you know, because it's one of the only ways that as a faculty you really can know. And one of the things that I always say that is as a teacher, you can ask a question in front of the class, and by this point in the semester, which is we're near the end of the semester, you know who's going to give you a right answer, who might be a little bit off, and if you're trying to move on, you can be like, maybe I'll just ask this person because I know we'll go, but you don't know where anybody else is.
Right.
And any sort of technology is such a great way to be able to figure out exactly where each student is, because that's the only way that you can help them.
Right. Yeah. So that onboarding, it was definitely that act of really even reinforced what I was doing and made me more excited, because I learned even more ways. Like now it's kind of like I'm a wizard. Now it's like there's no end to the madness, right? So I apologize to my students who are like they're even with reading case studies and articles, right? So I have a way of doing that now, and then also using ClassPoint. The real, again, even something as simple as calling a student, right? I like to use the randomize function in terms of randomizing who I would call. So like there's a little pin, a spinning wheel, and with all their names attached to it, and it's really cool because now you start to see the students sweat. So if you're worried about them being on their phone, they're going to put their phone down, because now they're going to go back to the notes and try to look at something, try to see if they're going to get called on. So that's like one of my
praying.
right, that the whip doesn't call on them, right? So it's now I'm not necessarily picking on somebody.
Right.
Now it's just really, again, I just use it. Right. Right. So again, I think that again it keeps the learning fresh, and that we think it's random, but again, I'm using this wheel, and then it spins, and then I love when they use the nicknames too, right? So, but again, like I said, who's this?
Right.
But yeah, so that's what we're calling. But yeah, it's a great way to really disrupt the classroom to where again, the student is going to come to class, and they're going to have to view the material, right? And that Rocklend, we know that Rockland's going to engage us in ClassPoint. He uses ClassPoint. He's going to ask, right? So, and that's really kind of how I know I can get my students to really kind of get the best of the material. So if I'm, again, engaging them, because I think we talked about on that onboarding about the exam question, and again, I've been using this a lot about, the exam is like an autopsy,
Yeah.
right? It's an autopsy report, and the summative response, the summative assessment, so take some of that summative, takes from that assessment, and use some of those questions, and maybe there's some concepts that we need to reteach. Maybe I can teach this better, right? And maybe this needs something where there needs to be a demonstration inside the class to where, like, hey, I need you to look at this here, again, to kind of help us to, again, get the material. So we're taking that autopsy report. Well, this is how the students did last time. So let's see if we can do this. This is a challenging concept. I agree. This is a challenging concept here. Or maybe maybe a student wasn't there that day, but I do find that now we have this report on how the students did. So let's take that report and use it as a formative assessment. So that way we can get the students, on board, like, okay, he asked something similar about this question, or that, I remember Rocco talking about this clinically. Why is this on my practical scenario, right? So,
Yeah. What is one of the best teaching or learning experiences that you have had? It could be either as a student or as a teacher.
oh yeah, I got these questions ahead of time. So, and it's always hard, and being in, I've been in school for a long time, and and I feel like I'm definitely I can relate to how the students are. I was a student in COVID, but I'm just trying to really think of just one learning experience. It really would have to be it would have to be during that leadership development conference when Dr. John DeWitt was talking about the mentor and having the students on there. I mean, I don't want to again maybe talk too much about it because I felt like talking about it, but it really was one of the best learning experience, because when you think of mentors, right, we look at, like, I'm set up with a mentor, right? I'm assigned a mentor, and I love my mentor, and again, he's a part of that wheel, right? But it really kind of just shows that in all facets of life, you have a mentor for life. My dad, he was a great mentor for me, but I knew, I couldn't get relationship advice from my dad, so I had another mentor who was good with relationships, so I knew I couldn't get relationship stuff with my dad, but again, that was one of the best experiences, because I started learning more about the students, and to really start to humanize myself, the stuff that I was kind of doing, but I really wanted to make it a point to where, I humanize myself. I wear, different character socks, and the students picked up on that. I like to wear, nice socks. It's a way, again, to disrupt the classroom there too as well, because if I'm doing gait training, I have different characters on different feet. Now they know which foot. If they recognize SpongeBob versus Patrick, well, I remember Rocklend used the example, hey, follow SpongeBob as your reference, as your reference lane. So, again, I really felt that was a really good learning experience, because students found that, I humanized myself, and then now I got these face socks. The students got a picture of my face when they were doing a Hoyer lift on me, and they took my face and made me some socks, because, again, that's it's great when that happens, and I'm glad that I did go to that conference, and I learned about that. It's like kind of the universe was saying, like, you have an opportunity here to really reach the next generation, really do some good here, and give everything, and pass on everything that to those students, so that they can make it better. So that was really one of the top learning experience most recently. And as I'm talking here, I'm just thinking of my other instructors who trained me in my PhD program. But yeah, that's got to be the top there, because again, without them, I mean, we wouldn't be here for sure. So,
What is the best teaching advice you received?
The best teaching advice. So it would have to be, so remembering students are humans as well. That's been a staple of, at least in my existence of my education. Went from when I went to undergrad at Thiel College to Concordia University, Chicago. Instructors, instructors I had, they've always made the point to, spend some time with your family. I mean, when we were on break, they said, take this opportunity to spend time with your family. I just really felt that made them more human and that they treat us as we are humans. They understood that, and I think that puts us down to a level where we can actually reach and connect with students better, because, they're here and they're looking for this education. They're trying to find the future, trying to find their place in life. And, so again, just understanding that they're human there too as well is gonna go a long way.
Wonderful. So this is the portion of the podcast where I ask 4 questions, and this is more rapid fire. I might ask you to give a little more detail on some of them, but the first one is, for those who are listeners, it's fact or fib time, where we ask you to give us something interesting about yourself, but it doesn't have to be true.
Mm.
And then at the end of it, we'll circle back. And since Kara's not here, I'll be the one to determine if you were telling the truth, if it was a fact or if it was a fib.
Okay.
So, give us something interesting about yourself.
I was a shot put thrower in college.
Okay. I'll think upon that.
Okay.
Favorite teacher and why?
Favorite teacher? Oh boy, I didn't know about this. Favorite teacher? It would have to be. Oh goodness gracious! I'm just trying to think of who's all going to be listening to this. If I get the link, I'm going to share it. So I better choose wisely. Favorite teacher? Does it have to be an actual teacher or?
We're pretty loose around here.
Okay, all right.
Wherever you want to go.
It would definitely have to be, and again, I'm not just doing this just to say it, but it would have to be Tiffany Kiphart from Kent State University at HBO. I mean, she instilled upon me. She was a faculty member at Kent State University where I went to become a PTA, and she's a PTA too. She was an instructor. Now she is the program director. But I had her as my first time going into the program, and then she was one of my last instructors when I left the program. So we started with her, we ended with her. So it's a little bit of the same how my position here at Tri-C. I'm with the students, they're as a prereq course, and then I'm with them throughout their 2 years in the program, and then they end with me. So it's kind of the same. It's kind of like it kind of it repeated itself. And I did see her a couple months ago in October when we presented at an education leadership conference, and I saw her and I told her, and she gave me a hug and I said, thank you for everything, thank you for believing in me. So she's definitely one of my favorite teachers for sure.
Wonderful. Most embarrassing moment in the
Oh
classroom?
my goodness, now there's a lot there too. It would have to be recently I was doing our bandaging lecture, and we were going through the protocols, the guidelines for bandaging. There's an acronym. We kind of made an acronym, and it doesn't really make any sense because it's not probably how it sounds. But we called it Deaconer, and you would think it's DE, but it's actually DA. As I was going through it, I started really confident. You start distal, work proximal. So that means you start further down, you work your way up to help with the fluid and edema. And then I got to the A. I didn't even get all the way down. I got to the second part of the A, and I was like, it was this pause, and then I turned around, I'm like, I forgot. and it was the student version. So when you click on the PowerPoint, it wouldn't, the animation wouldn't pop up. So it was the student version. So they were waiting for me. And I was like, yeah, I forgot. So I had to go and look, I had to stop what I was doing, and then I had to go and get my other teaching PowerPoint because I had the answers there. So,
yeah.
So again, understanding from a student point of view, we forget things, it happens, you forget things, right? So, but yes, that was recently most embarrassing, but there's probably one every semester. So.
Yeah. And you're human, right?
Yeah, right. That's true.
how
Yeah,
students see
they,
it, right?
they understood. They definitely laughed about it, and I definitely got made fun of for a week. But it was cool. No,
All in good fun at that point.
yeah,
Right?
right. No, it was funny. Yeah.
So the last one, did you find teaching, or did teaching find you? Meaning, was it always your goal to teach, or you discovered it in another way?
Yeah. So teaching was something I always wanted to do. If you were to talk to my wife or any one of my colleagues or my friends, even some of my and past instructors, it was definitely always a goal of mine. How to get there was, obviously the hardest part. Who was willing to take a chance at somebody with no teaching experience. So I knew what I was up against. So I was willing to do anything and everything. I didn't care if it was a lab assistant. Just get me in there so I can learn. And so I wanted to teach. Now, the opportunity here at Tri-C, it found me. I was actually in the process of, looking for places to live in Chicago. So I was going to move to Chicago to go do my PhD. I actually got a call, and this is my shout out to Tanya Wright. I got a call from the program director for the physical therapist assistant program, and she had reached out to me and really spoke about the opportunity, that was at hand to really do some good and to give me some experience. So, but the main thing that she talked about was that you have an opportunity to really work with an amazing group of students that come in here at Tri-C, and and have the opportunity to do something good. So I was actually working out, and I stopped what I was doing. I was so excited. I called my wife. I ran home and I said, "There's gonna be an adjunct opportunity here. We won't have to move if this something happens where here." And my wife was totally on board. So I knew I wanted to teach, and right when I didn't really know what was going on, my future was not planned, or it was didn't know what I was gonna do. It definitely found me, and I really had an opportune time, because I really want to help not only the physical therapy profession, but I also want to help students, at this time. So always want to be known for something, right? Whether a title or someone in your family, someone in the community, you want to be known for something, so. And yeah, I'm so happy
Yeah.
that it did find me.
Wonderful. Shot put thrower.
Yes.
I'm going to say fact.
Yes. Correct.
I finally got one right.
Yes. So I was a two-sport athlete, but mostly everyone thinks I played football. I was either gonna do. I had hair past my shoulders. I had long, really, really long hair like Troy Polamalu.
Mm-hmm.
I was gonna say that one, but yeah, most everyone thinks I'm a football player, and I am. Now I threw shot put. I didn't want to throw shot put in college, but I also have the record at Thiel College.
Fantastic.
Yes, it was. Yeah, I have the record there, and records are meant to be broken. I hope someone breaks it. But yeah, and I had a nice career there too as well. So I was a two-sport athlete, and again, when I showed pictures of me throwing shot put, like I didn't know you threw shot, right?
Yeah.
So yeah, and then that was a fun time. So we were done really early in the meet, so we would always throw the first. We were the first event,
Right.
so I'd always study afterwards. So
That's fantastic. Rocklend, thank you so much for your time.
No,
I really enjoyed this conversation.
No, it was really cool. No, I really enjoyed it.
So happy that you're here.
Yes, I'm very
happy that Tri-C found you and brought you in.
Yes.
And I'm sure the students are also very thankful.
Yes, I'm very
thank
thankful.
you so much.
Thank you for the opportunity, Brian. Thank you. All right.